Hi, this is Tiffany Raffegeau coming from the University of Utah in Salt Lake City, and I'm going to talk to you about our work looking at age-related differences to turning behavior in anxiety-inducing settings. So we're interested in looking at the fear of falling in older adults, and that's because older adults that report a fear of falling tend to walk slower and they have worse adaptive stepping strategies, which puts them at an increased risk for falls as compared to their healthy peers. We also know that if you fall during a turn, an older adult is 8 times more likely to experience a devastating hip fracture. And even though 40% of daily steps are turning steps, there's very little known about the relationship between the fear of falling or mobility-related anxiety and turning behavior in older adults especially. So the purpose of our study was to investigate potential age differences in turning behavior in anxiety-inducing settings. And to do this, we used virtual reality. We used the HTC Vive 2.0 and asked individuals to wear our head-mounted display and immerse them in a realistic virtual setting. They walked along a walkway that was 2.2 meters long, and it was matched to a real-world walkway. We also asked individuals to wear inertial sensors that were strapped around their waist and their ankles so that we could measure peak turning velocity. And we used ankle trackers so that they could monitor the position of their feet inside the virtual environment. To determine the effect of anxiety, we then transported individuals to a simulated high elevation. This is a common approach in the literature to induce anxiety. So here we lifted people to a simulated 15 meters up in the air, and we asked people to continue walking along the walkway, turning back and forth for 1 minute at this high elevation. Between manipulations, we asked people to report their levels of cognitive and somatic anxiety, their confidence in their ability to do the task, and the amount of mental effort they had to devote to get that particular task done. Our primary outcome measure was peak turning speed, and we were able to bring in 11 young adults and 13 older adults. And what we saw in general was if we compare the left and the right panels, when we asked people to speed up, they were able to speed up their turns about 26 degrees per second. When we brought people up to a higher elevation, so you look on the x-axis and you can see we go from low to high heights. You see broadly both groups did significantly slow down their turning speed about 16.5 degrees per second from low to high elevation. And although there were no significant interactions, we did see a trend towards significance for an age effect. And because we see that about 20 degrees per second slower in older adults than young adults, we wanted to look at that a little bit further, given the magnitude of that difference. And that was because at high elevations and at self-selected speeds, older adults turned about 16.5 degrees slower than young adults. And at high elevations and fast speeds, they turned about 21 degrees per second slower than young adults. And our self-report ratings helped confirm the efficacy of our VR height illusion. So although there were no differences because of speed or due to group, we saw consistent increases from low to high elevation in cognitive anxiety and somatic anxiety, showing that people's level of worry and tension rose at high elevations. And this was echoed in their levels of confidence, where from low to high elevation, they were less confident in their ability to complete the task. And from low to high heights, they had to increase the amount of mental effort they devoted to complete the task. So our main take-home message is, first, we did find evidence that supports using virtual reality to induce mobility-related anxiety did work, even in healthy older adults. And that provides some really promising evidence that potentially we could use virtual reality to test realistic tasks that could generalize into daily life. Also, we did see some evidence that pointed to greater differences in older adults than young adults, suggesting they might be more susceptible to these mobility-related anxiety deficits. And that certainly warrants further investigation. Given the magnitude of differences was about 20 degrees, and previous research has identified a difference of about 6 degrees to distinguish fallers, we believe that the clinical meaningfulness of this difference certainly warrants further research. I want to thank you all for your time.